If you're thinking about improving your skin quality without having that done look, this may be for you and where polynucleotides comes in. In this short video, we're going to go over what polynucleotides are and how they differ from the more conventional aesthetic treatments like Botox, and what each treatment is actually for. So first, let's take a step back and remember what our conventional treatments like Botox are actually for. They're tending to treat by temporarily relaxing the muscles and are used primarily where you have dynamic. That's where you're actually moving your face wrinkles. So maybe the crow's feet, the frown lines on the top of the forehead. But what it does not do is improve your skin quality or hydration of the skin. So what are these new polynucleotides? Well, it's a more newer form of treatment where the product is actually derived from DNA fragments. And what they do is work at a cellular level. So our fibroblasts, that's our own cells, are stimulated by them to try to make the collagen and elastin and tissue repair. And it actually helps by improving the skin quality, elasticity, and hydration. Botox, the more conventional injectable, is like turning down the muscle, whereas polynucleotides are more about improving the skin texture and health itself. But let's go over our core comparisons for the usual facial injectables versus the newer polynucleotides. So the mechanism of action, remember, the conventional Botox is more about muscle relaxation, whereas polynucleotides are about tissue regeneration. With the results, Botox tends to give you smoother lines when the face is still, but polynucleotides will give you a better texture, glow, and elasticity, along with some more rehydration of the skin. In terms of a timeline as well, Botox is visible within days, however, tends to wear off after 3 to 4 months, whereas polynucleotides have a much more gradual improvement over weeks, with cumulative benefits. And the look and the feel? Well, Botox can also reduce the expression and give that slightly frozen look, whereas polynucleotides will give you a much more natural, skin looks healthier rather than altered look. So, who is each treatment actually best for? Well, it's very important to remember that they're not actually competitors, they're tools for different goals. Botox is formed from people who have stronger muscles and in their movement of them cause deeper expression lines, whereas polynucleotides are more for patients with duller skin, finer lines, under eye quality, and early signs of aging. So, can they be combined? Well, the answer is yes. They're often complementary. Botox controls the movement, whereas polynucleotides improves the skin quality. So, combining the treatments is increasingly common. Let's also discuss some of the risks and expectations around the treatments. So do expect that you'll get some mild swelling, redness, and additionally, the results aren't instant with polynucleotides. It's also not a replacement for everything. And for the couple of days after, we always advise patients to not have things like makeup or big events on. What's the take-home message? Remember, Botox and its equivalents change how the muscles move, whereas polynucleotides change how the skin behaves. And the best treatment depends on what you're trying to improve, and we're here to help you decide that when you're at the practice. Thanks for listening.